This year's World Mental Health Day celebrations were marked nationally at Gilgil in Nakuru County. This hospital being a little-known institution established in 1965 to help the Mathare National Mental Hospital to contain its population.
This section was specifically opened to decongest the Mathare Mental Hospital. And that time, about 400 patients were brought here. Of course, with nurses, they are their own doctors. And it was like that for quite a long time, until sometimes in 1985.
To date, some of the patients admitted here in 1965 are part of the aged people living here. They call this place their home, but the hospital is in poor condition.
Sometimes the national government, they used to assist us with their upkeep, food, clothing. But after the devolution, I think they said the place was devolved.
We as government, the best we could do is offer a safe environment where they could not harm themselves, procure drugs, since it was a national government function to procure drugs for them. Our biggest budget is food, because the side effects of the drugs they take is based on their diet.
According to a status report by the American National Academy of Sciences, Engineering and Medicine, mental illness accounts for 11% of Kenya's disease burden, yet there are very few specialized psychiatric doctors and nurses for the 40 million plus Kenyans at the moment. The report further says that there are 54 psychiatrists and 418 psychiatric nurses in the country.
Like now that the nurses are on strike, even if they go on strike, there's no way you can leave these people without somebody to cater for them.
We have psychiatric nursing. It's a course that is taking 1 year in Mathare. And I think if the assembly can really push for the budget to increase this money for training, because what happens is when our budget goes there, training monetary allocation goes down.
Apart from inadequate medical assistance, mentally ill persons and their families still suffer from societal stigma. This is why World Vision is partnering with this hospital in Gilgil and Naivasha to help bridge the existing gaps in the mental health care system.
Tunafundisha watu huko mashinani jinsi ya deal na problems kusudi they don't escalate into mental illness. So we are able to do this through the help of community health volunteers.
This hospital is a former British barracks that was converted into a mental institution after independence. It is not known to many that this is a branch of the Mathare Hospital in Nairobi County. The state of the patients here is dire since they lack enough food and money to supplement their medication. Brygettes Ngana, NTV, Nakuru County.